Hi, my name is Shreya, and my team is working on AmbuMate, which is an invention that makes it easier for patients to walk while in the intensive care unit. Patients in intensive care units are generally immobilized in bed, which means that they are at high risk for a variety of illnesses collectively referred to as post-intensive care syndrome. Post-intensive care syndrome can include such complications as neuromuscular weakness, pressure ulcers, and deep vein thrombosis. Ambulation, or getting patients up and walking twice a day, has been shown to mitigate the effects of post-intensive care syndrome, prepare patients for life at home, and shorten hospital length of stay by as much as 23%, which saves both the patients and the hospitals a lot of money. However, there are many challenges with ambulation that prevent it from happening as often as it is required. The current process is inefficient and unsafe. ICU patients require many different pieces of equipment that must all be transported together. In the current process, 5 to 8 nurses are generally required to ambulate one patient, and many of these clinicians are only pushing equipment. Additionally, ICU patients are connected to many wires and tubes that are at high risk for dislodgement and tangling, posing a serious safety hazard. ICU patients also need a significant amount of support, and current ambulation methods make it difficult to guarantee this. These inefficiencies and safety risks limit the number of times that ambulation can occur, especially given limited clinician staffing. Our team has created a device, the AmbuMate, that effectively overcomes all of these challenges, as shown through the IRB testing that we have completed thus far. Unlike any device currently on the market or the current ambulation procedure, our device is capable of carrying all the equipment needed by a patient, requires only one nurse to ambulate a patient, includes many methods of support in case of patient fatigue, and includes a novel wire and tube management system to prevent wire dislodgement and tangling, all while integrating seamlessly into the current clinical workflow. We created this device in partnership with Dr. Kudchudkar, head of the Pick You Up program at the Johns Hopkins Hospital, which is a program comprising of 70 hospitals across the United States dedicated to increasing the incidence of ambulation in intensive care units. And our designs are guided wholly by the feedback that we receive from nurses currently facing issues with patient ambulation. AmbuMate thus has a unique ability to penetrate the hospital market by marketing first to pediatric intensive care units through the Pick You Up network. We will first target those pediatric patients who are at high equipment levels, meaning that their condition requires the use of more equipment, eventually having the opportunity to move to all patients of the PICU, the ICU, the general hospital floor, and rehabilitation centers. To sum up, the AmbuMate is a device that will allow patients to get up and move better than any other device on the market, allowing patients to heal quickly and without complications. Thank you.